The courts, justice, what are you doing in this area with your project?
Well, that's basically how it all started. Originally, because I've been regularly over the years voicing problems and how to resolve them, it's interesting. 20 years ago, when a problem occurred between the use of the laser with two gynecologists here at Northridge, someone remembered that I found it strange that there was no mechanism to check on the competence and the practice of the use of the laser in the operating room. So I was asked, once there was an accident, that the drape of the patient burned because the laser beam was shot in the wrong direction. Nothing happened because there was a blanket under it and the nurse had a syringe with water. But it was a good sentinel accident, as it's called.
Sentinel?
Sentinel accident. That's what is the term used in the profession. Of what is something...
Nothing bad happened, but it proved, in a sense, to be almost an experiment to stop this in the future.
Correct. Something happened, and there was a desire to see that it doesn't becomes more significant.
A non-planned experiment.
You got it.
All right.
And so I was at that time asked to become chairman of the Laser Safety Committee for the whole hospital. Years later, continuing routinely to point out when there are problems that I think can be easily fixed, offering to teach and educate nurses or doctors, as I've done over the years, the whole atmosphere in healthcare has changed. Out of the blue, I got a phone call on June 13, 2000, because I'm listed in the Los Angeles County Bar Association as an expert for attorneys to call and get opinion. And I thought I had the most stupid question I've ever heard in my life. I was asked, do you think it falls below standard of practice to remove 2 tubes from a patient? I says, what are you talking about? Tubes in the ears? He says, no, fallopian tubes. I said, it sounded so barbaric. I said, is this in Africa, India, Mexico? She says, no, it's in the United States. Says, Texas? She says, no, California. So I couldn't believe it was in a metropolitan area. Says, Bakersfield? She says, no. She says, Tarzana Hospital. Now I don't believe her at all. Why? I have been there on staff for 14 years. I am intimate part, of the internal quality control of the hospital. That happened 2 years before. I never heard about it, so it never happened.
I have a bad feeling about what you're going to tell me next.
What I did not even imagine could be possible. You know how nurses and doctors love to talk. How are they able to prevent the nurses from talking with other nurses, the doctors to talk to other? No one in my whole department was ever introduced the chart and the problem over the whole period of time. Yet it was a public record. A lawsuit was filed. That's why someone called me. And so I was horrified to discover that not every complication goes through the internal pipeline of the quality control. And so I reasoned the following way. If this happens in my department, it must happen in the other department in the same hospital. If this happens in this hospital, it must happen in other hospitals. And I did not realize how widespread that problem is. And what caused me even more concern when I became threatened by the hospital. And I says, I don't see anything unusual here of what I'm doing. I mean, anyone, you don't need to be a gynecologist to know that it falls below standard of practice to remove 2 tubes from a patient without her consent. They also lost 3 frozen embryos, by the way, and they failed to tell the husband that he was suffering from a severe liver disease. I didn't think I was doing anything extraordinary or unusual. What shocked me to discover is that the healthcare industry operates under the same spirit as in the Godfather's movie. There's nothing personal against me here. My name could be Smith or could be X or Y. This is pure business. It took me a long time because they say doctors are quite naive, and this doctor was very naive. I was not able to think out of the box or in criminal terms. But once you follow the money, as a great Jew who was the assistant of Edgar Hoover in the FBI, which we know now was Deep Throat, said, follow the money. What I did not realize is what you and I would call a good physician. A physician that admits patients to a hospital only when necessary, only when indicated. Physicians who have the least possible errors and complications are actually the worst possible physicians in terms of corporate terms, because the revenues generated by such physicians to the hospital are far less than those physicians you and I would call good physicians. In a tragic situation in Redding, in Northern California, 83% of cardiovascular surgeries were performed on healthy people.
This is really bad news.